Kia ora koutou. I'm David Waite, NZNO's Industrial Advisor for the DHB sector and advocate for our DHB MECA negotiations. In this video, we're going to provide you with an update on bargaining so far and talk about our next steps. Towards the end of 2019, we began preparations for our MECA bargaining. Starting with the recommendations of the Wilson Report, we've built a campaign and bargaining process that focuses on member involvement and member voice.
I'm Karen Marshall, a NZNO delegate, national delegate, and a member of our 2020 NZNO MECA bargaining team. This document outlines the claims for renegotiating the NZNO DHB MECA. A significant set of claims highlighting the issues faced by nurses working in DHBs were established through delegate-run member meetings and an online survey. It is clear there are three significant and specific issues. We need pay that values our work. We need enough staff to safely care for our patients. We need time away from work when we are sick. There are also a number of issues raised as claims that provide support so we can remain focused and resilient, support professional development, and recognise the contribution members make which improve our healthcare system. These claims were endorsed and our bargaining team took these claims into negotiations.
We started negotiations on the 23rd of June and to date have had 6 days of bargaining divided into 2 rounds. The DHBs did not present any claims and much of the first 3 days was spent going through NZNO's claims. Some of our claims are administrative in nature and of little consequence. However, some of our claims reflect the impact that years of underfunding have had on our members, and the as yet unfulfilled commitments around staffing levels that will allow us to safely care for our patients.
The DHBs presented a letter from the State Services Commission outlining the restraint they are seeking in bargaining, which calls for no pay increase for workers earning over $100,000 and either no increase or a minimal pay increase for those earning less than $100,000. Your bargaining team strongly rejected that position. This letter is on the website dhbmeca.nzno.org.nz. We spent some time discussing the 2 main aspects of claims related to safe staffing, although we have yet to reach an agreement. These claims, firstly, require DHBs to measure shifts below target for every ward or service on every shift and to staff at levels of 0 variance or greater, according to patient acuity, or to meet the planned roster where trend care is not yet available. Secondly, require public reporting for every shift on every day by posting a notice in the workplace stating if staffing was above or below target measure and a penalty imposed made to staff working in an understaffed environment which would work in the same way as other penal payments, such as night rates. There is an information sheet for members to help go through the staffing claim on the website dhbmeca.nzno.org.nz.
We also explored the option of a short-term agreement given the uncertainty of the current situation with COVID-19. Earlier in the year, the senior doctors had agreed to a 1-year collective agreement with a 1.9% pay increase. In our claims survey, we asked members whether they supported us investigating that kind of offer, and 71% of members filling in the survey did. Ultimately, however, we were unable to reach an agreement with the DHBs that looked sufficiently like the offer they had made to the senior doctors earlier in the year. The major impediment to that being the DHB's desire to sit within the bargaining expectations placed upon them by the State Services Commission. Our next steps are to return to bargaining on the 10th and the 11th of September after our report back meetings have been concluded. Of course, those meetings now run by Zoom, and we will keep you updated. Thanks very much.